Did you know that some of the most common beliefs about glaucoma could actually be putting your eyes at risk? Imagine believing that you're safe from a condition that slowly damages your sight, only to find out you've been completely wrong. In today's video, we're uncovering the 10 worst glaucoma myths that could be threatening your vision. From thinking only older people are at risk, to believing you'll know when glaucoma strikes, these myths are more dangerous than you might realize. Stick around as we break down these myths, reveal the truth, and show you how to protect your eyes from the silent thief of sight. By the end of this video, you'll be armed with the knowledge to safeguard your vision and take control of your eye health. Don't let these myths put your sight in danger. Myth number 1. Glaucoma only affects older people. A lot of people think it's a condition that only hits in your 60s or 70s. But the truth is, glaucoma doesn't have an age limit. Sure, as you get older, your risk increases, especially with factors like elevated eye pressure. But younger people can have glaucoma too. In fact, around 10% of those diagnosed with glaucoma are under 40. That's right, it can strike at any age, often going unnoticed by those who think it's just for seniors. Imagine being in your 30s or 40s, feeling perfectly healthy, and finding out you've been walking around with elevated eye pressure that could be damaging your sight. That's why getting your eyes checked in your 30s is just as important as in your 60s. The American Glaucoma Society reports that nearly 2.7 million Americans over 40 have been diagnosed with glaucoma. But more younger people are being diagnosed too, and that's a warning sign. Don't wait until you're older. If you feel fine, you might still be at risk. Early detection is crucial. So remember, age doesn't define your risk for glaucoma. Whether you're in your 30s, 40s, or younger, regular eye checks are essential. It's simple but important. Myth number 2, you'll know if you have glaucoma, it's obvious. This belief can seriously put your vision at risk because honestly, if you're waiting for obvious signs, you might be too late. Glaucoma is sneaky. It's called the silent thief of sight for a reason. In the early stages, there are no obvious symptoms. No pain, no flashing lights, no major vision loss. Many people live with it for years without noticing any changes in their vision. By the time you notice vision loss, the damage is already done. The condition has silently progressed while you thought everything was fine. The World Health Organization notes that most people don't recognize glaucoma symptoms until it's in an advanced stage. That's why regular eye exams are critical. Don't wait for something obvious to show up. By then, irreversible damage could already be done. In some cases, by the time patients seek treatment, the vision loss is so severe that it's irreversible. Glaucoma can cause blind spots in your peripheral vision, which you might not notice until they worsen. This gradual loss makes early detection essential. It's your best chance to prevent further damage and protect your vision. So, don't wait for noticeable symptoms. Regular eye screenings are the only way to catch glaucoma early. Think of them as preventive care for your eyes. Catching it early is far better than dealing with the consequences later. Myth number 3. Glaucoma is caused only by high eye pressure. While elevated eye pressure is a major risk factor, it's not the only one. So if you think normal eye pressure means you're safe, think again. High intraocular pressure (IOP) is a key risk factor, but glaucoma can still develop in people with normal eye pressure. That's right. Normal eye pressure doesn't mean you're out of danger. According to the National Eye Institute, other factors like genetics, age, ethnicity, and health conditions such as diabetes can increase your risk, even if your eye pressure is normal. For instance, African Americans and those over 60 are at higher risk. Certain health conditions, like diabetes, can also raise your chances of developing glaucoma, along with things like thin corneas and high blood pressure. Some people with high eye pressure never develop glaucoma, while others with normal pressure still do. So if you're focusing only on eye pressure, you're missing the bigger picture. Glaucoma can arise from various risk factors, and regular eye exams are key to catching any hidden issues. Myth number 4. Glaucoma only affects one eye. Many people believe that if one eye seems fine, they're in the clear. But that's not the case. Glaucoma doesn't just target one eye. It can affect both, even if it starts in only one. While glaucoma often begins in one eye, it usually spreads to the other over time. Untreated, The disease can silently damage both eyes. A study in clinical and experimental ophthalmology shows that glaucoma is bilateral, meaning it often affects both eyes, even if it starts in just one. Just because one eye seems fine doesn't mean it's safe. Regular eye checkups are essential to catch any issues early, especially since you may not notice problems until it's too late. If you're over 60, this becomes even more important, as your risk for glaucoma increases with age. It's better to stay ahead of potential problems than to wait for signs to appear. So don't be fooled, both eyes need regular monitoring, even if only one feels off. Myth number 5, if you have glaucoma, you will definitely lose your vision. This one can be scary, and it's easy to see why. The fear of losing your sight is real, and when diagnosed with glaucoma, it's natural to worry. But the truth is, glaucoma doesn't guarantee vision loss. With early detection and the right treatment, many people manage the condition without significant vision loss. I'm not going to sugarcoat it. If left untreated, glaucoma can cause permanent vision loss and even lead to blindness. But here's the key: early diagnosis means you can prevent further damage. So just because you've been diagnosed doesn't mean you're doomed to lose your sight. The American Academy of Ophthalmology confirms that with treatments like eye drops, laser therapy, or surgery, glaucoma can be managed effectively. It's all about catching it early, which is why regular eye exams are crucial. Early detection gives you the best chance to slow or stop the progression. Many people with glaucoma live full, active lives with good vision, so don't let the fear of vision loss hold you back. The key is to stay proactive with treatment. Ask your eye doctor about the best plan for you. There are plenty of effective options out there. So if you've been diagnosed with glaucoma, don't panic. There's hope, and with the right treatment, you can protect your sight. Myth number 6, glaucoma treatment is expensive and ineffective. Many people hesitate to seek treatment because of cost concerns, especially if they're on a fixed income or already have medical expenses. But the truth is, glaucoma treatment can be both affordable and highly effective, especially when caught early. While treatment costs vary, many options are accessible and have high success rates. For instance, eye drops, the first line of defense, are usually affordable, and many insurance plans cover them. Generic versions can also save you a lot compared to brand name options. Here's the thing: waiting can make treatment more expensive and complex. If you wait until glaucoma is advanced, you may need costly procedures like laser surgery or even traditional surgery. But catching it early means simpler, cheaper treatments. Research from The Lancet shows that people who follow their prescribed medications and get regular checkups manage their glaucoma effectively and avoid vision loss. Early treatment keeps the disease under control, preventing expensive procedures later on. Laser treatments like selective laser trabeculoplasty, SLT. It's affordable, has a high success rate, and can be done in a doctor's office with minimal recovery time. It's definitely worth considering. The bottom line: glaucoma treatment doesn't have to be expensive, and it works. So don't let myths about cost or effectiveness keep you from seeking help. The earlier you start treatment, the easier and more affordable it is to manage. Myth number 7, glaucoma is curable. If only that were true, right? Unfortunately, glaucoma is a chronic condition, and once diagnosed, there's no cure. But that doesn't mean you're out of options. While there's no cure, you can manage the disease and live a healthy, full life. Glaucoma treatments focus on controlling the condition, not eliminating it. With the right care, you can slow its progression, prevent major vision loss, and maintain good quality of life. Early detection is key to managing it, so the sooner you catch it, the better. The National Glaucoma Research Foundation confirms that while we don't have a cure yet, modern treatments can prevent the disease from progressing. Eye drops, laser treatments, and surgery lower eye pressure, which helps protect the optic nerve and preserve vision. So while a cure may be a long way off, we have plenty of effective treatments available now. The goal is to manage glaucoma and keep it under control. And remember, the earlier you start treatment, the better your chances of maintaining your sight. Myth number 8, only people with family history of glaucoma need to worry. This myth can give you a false sense of security if no one in your family has had glaucoma. But the truth is, glaucoma can develop in anyone, even if it doesn't run in your family. Yes, a family history does increase your risk, but it's not the only factor. Age is a major factor, and if you're over 60, your risk increases significantly, regardless of family history. So even if glaucoma hasn't appeared in your family, it's crucial to stay proactive and get regular eye exams. A study in the British Journal of Ophthalmology shows that people without a family history can still develop glaucoma, especially if they're over 60 or have conditions like diabetes or high blood pressure. Certain racial groups, such as African Americans, also face higher risks, regardless of family history. Don't base your risk solely on family history. If you're over 60, have other health concerns, or belong to a higher risk group, regular eye exams are essential. Glaucoma often has no symptoms until it's too late, so being proactive is key. Myth number 9, laser surgery for glaucoma is risky. When people hear surgery, they often think of complications, danger, or long recovery times. But when it comes to glaucoma, laser treatments are actually safe, effective, and much less invasive than traditional surgery. One common laser treatment for glaucoma is selective laser trabeculoplasty, SLT. This procedure helps lower eye pressure by improving fluid drainage in the eye. It has a high success rate and is often done right in your doctor's office with minimal recovery time. While every medical procedure has risks, the risks with SLT are much lower compared to traditional surgery, which is usually reserved for more severe cases. SLT is quick, with most patients able to resume daily activities soon after, and any side effects are typically mild. Research from the Journal of Glaucoma Surgery shows that laser treatments like SLT can significantly reduce eye pressure and help prevent vision loss for many patients. It's an excellent option for those who don't respond well to medications or want a more lasting solution. So if you've been hesitant about laser surgery, it's time to reconsider. Laser treatments for glaucoma are safe, effective, and often the best option for protecting your vision without the risks of traditional surgery. Myth number 10. You don't need regular check UPS if you're symptom-free. It might sound tempting. If you're not in pain and your vision seems fine, why bother with a checkup? But here's the reality. Glaucoma often doesn't show symptoms until it's too late. Glaucoma can be completely asymptomatic for years. No pain, no noticeable changes in vision, nothing. You could have elevated eye pressure, silently damaging your optic nerve, and not even know it. By the time you notice changes in your vision, the damage could already be irreversible. That's why regular eye exams are crucial. Studies published in Ophthalmology Times show that people who get regular eye exams are more likely to catch glaucoma early, when treatment is most effective at preventing vision loss. The longer you wait, the more likely the disease is to progress, making it harder to treat. If you're over 60, eye exams should be part of your routine, just like dental visits or annual physicals. Even if your eyes feel fine, regular checkups are essential. Don't wait for symptoms to show up. By then, it could be too late. So, don't skip those checkups. They could be the difference between keeping your vision and losing it to glaucoma. Now that you know the truth behind these 10 glaucoma myths, it's time to take action. Are you going to wait for symptoms to show up, or will you schedule that eye exam and take control of your vision today? Remember, glaucoma can be silent, but your response doesn't have to be. If you found this information helpful, don't forget to hit that like button, share this video with someone who needs to hear it, and subscribe to our channel for more valuable health tips. Oh, and make sure to turn on notifications so you never miss a chance to learn how to take better care of yourself. If you're ready to dive deeper into protecting your health, check out the next video on the screen. Let's keep your vision and your life clear and bright.